All right, hello everybody. Today we are going to present a plugin called AutocodR, which uses natural language processing to boost coding efficiency. So for every hour that doctors spend with patients, they spend 2 hours in the EMR system. And this increases physician burnout, which is associated with a $4.6 billion annual cost and worsens patient outcomes. So our mission is to help physicians realize their fullest potential by transforming their EMR operations to be more smooth, efficient, and predictable. And one of the burdensome tasks that providers do in the EMR is to deal with the ICD-10 insurance billing code. Oh. See the presenter view? Yeah. Oh, it says it's warming up.
There, look at this flash. Okay, and go into. Are you guys okay?
Yeah, just, okay.
Can you give me a presenter view?
Yeah.
Okay.
Okay.
Perfect.
Perfect. Yeah, I was nervous about that.
Even
Okay,
we
thank
can-
you. Thank you, Anthony. You won't penalize us for that. Okay, so the ICD-10 system is a complex computing coding system that is used after every patient interaction, and it's so complex that there's an entire profession created to deal with it in medical coders. So just to give you an example of how tedious this is, you have a disease like schizophrenia. It has codes, and there are various subtypes of schizophrenia that have other codes, and this makes entering data into an EMR an excessive burden to physicians that is repetitive, painstaking, error-prone, and stressful, and overall it damages the patient-physician relationship, which takes time away from the patient and can directly harm them. As an example, incorrect codes can lead to wrong procedures being conducted. So our solution is to just automate it by extracting ICD-10 codes from clinical notes, weighted and refined by the patient's clinical history. So our aims are to save provider time and improve care, especially outpatient providers who input ICD codes immediately after patient visits, and to save money by reducing erroneous codes, which ensures proper patient reimbursement, efficient hospital billing, and reduces the need for medical coders. And as an example, miscoded procedures even can cost up to $15,000, and 14.5% of primary care revenue alone is consumed by billing costs. And there are other entities focused on this problem. However, adoption is still very low. Less than half of hospitals adopt any kind of computer-assisted coding technology. And for now, almost none of these use machine learning, which is important to address the complexity of the new ICD-10 system. So our solution is a plugin that seamlessly integrates into EMR systems such as Epic's Open API to extract ICD codes from clinical notes from the current visit, weighted and refined by the patient's history, which includes every lab, vital, diagnosis, procedure, prescription, and prior clinical note. And this will be inputted into our natural language processing algorithm, which is a recurrent neural network consisting of long short-term memory units that create an embedding of structured EMR data and uses attention mapping to output probability scores of ICD-10 codes in a sorted list. So for example, after a visit, this is the workflow for our system from the provider's perspective. So here is a clinical note, and this note as a whole, along with the patient's prior history, will be inputted to the algorithm, which highlights these key terms, outputting a list of ICD codes, and all presented for a reviewer, which will highlight codes that require closer review by the provider, which you can then disambiguate, show, and this aligns with our philosophy that the best EMR is the one that removes itself from the patient-provider relationship, and thank you very much.
So at the end, the physician or clinician will still have to review these codes here to make sure, as you said, to disambiguate them?
There is
So-
no way to not have a physician to do that. This is so important that it has to be reviewed in any case.
Okay.
If AI learns from a worst case scenario or a situation that has never arisen, and it takes longer to learn, and those I would assume would be the patients that are the more severe patients that a doctor would work with, how do you account for that?
So in a system like this, what In a system like this, what we hope to be able to achieve is a continuous learning system, meaning that for any new cases that arises, the system would learn from these new cases and would adapt itself so that it can care for every situation.
But it has to learn from that person.
Exactly, yeah.
Yeah.
So it means that it will learn at some point from humans, but
But as again, all these codes are subject to review at the end by a provider, so nothing is sent off before the provider looks at it. And as we showed, anything that the machine is unsure about, which assigns a relatively low probability score to, being the highest probability score in the space, will still have to be flagged by the yellow triangle as we showed visually. So nothing is sent off before a provider looks at it.
Your basic technical proposal of taking recurrent neural networks and then using structured data to condition them in terms of outputs, I like that approach. It actually turns out to be surprisingly difficult to do that with ICD-10 codes. I can speak from experience on this problem. But I think I like the basic technical concept. I think my major question or criticism was, a lot of your presentation focuses on the benefit to physicians, whereas to me, physicians don't do a lot of the coding. There's a lot of professional coders and actually companies that it's outsourced to. So in many ways, I think really your product market fit is more oriented towards hospitals and increasing revenue capture, maybe decreasing the size of professional coding staffs. So maybe I would orient my presentation and focus a little more towards that.
that's a very fair point. We maybe did not emphasize this enough, but what this system would aim to is reduce the number of medical coders you would need in a hospital in-house, so that would reduce the cost related to coding in general.
Thank you.